way. And so you're absolutely right. We've made progress. I think Patrick and Chris have set that out. But in terms of care homes, we're absolutely gripping this. The Home Health Secretary on Wednesday set out a plan, and you asked in particular what's the detail of what we're doing. That the plan was to make sure that all care home residents and staff with symptoms will be tested, that all patients discharged from hospital will be tested before going into care homes. Care homes are being supported with different mechanisms to order PPE quickly. We had a local resilience forum drop to deal with distribution to care homes, obviously dispersed more widely than hospitals. We've had one last week. We've got another one this week. We're working up the Clipper service, which will regularise and expedite the distribution more generally. We've got the plan to expand the workforce in care homes to 20,000 through a new recruitment campaign and new guidance to minimise the spread of the infection. So we recognise that the virus hasn't spread uniformly. We're absolutely committed to making sure wherever it's reared, it is being tackled in as targeted and as concrete way as we possibly can. I think, Patrick, did you get the second one, or was that Chris?
I think me first, but Patrick might want to add to that. I've said from the early on, you're absolutely right, that indirect deaths, we need to think about an indirect other illness. Death is not the only thing. If someone has had, for example, a major operation postponed, that also is something that we need to remember and take account of. So just to remind people, the 4 things I've laid out are direct deaths from the coronavirus, indirect deaths because the NHS emergency services are overwhelmed, and because of what the British public have done, and because of the fantastic work of my NHS colleagues, we have not come close to that, and we do not intend to come close to that. But the 2 other forms are indirect deaths because the NHS is reoriented towards COVID-19, and therefore less able to do other things that are not necessarily so urgent but are very important. And then finally, we know that anything that increases deprivation can in the long run cause issues. And we are absolutely looking at how these work and how they interact, because in coming to the next phase of this, we need to take account of all of those rather than just think about the direct COVID deaths, because if we just thought about those, we could end up having a much less targeted approach, and one that didn't allow the NHS to respond properly to all these other indirect causes. And this is actually something which SAGE, which Patrick chairs, has looked at in some detail and will continue to do so. Patrick, you want to add to that?
We look at it, and just to reiterate the point I made earlier on, at the moment, this is not a tension between the economy and health. It's very clear what we need to do now, which is to keep this down, stop this from coming back again, stop a second wave, which would need a second lockdown if that occurs, and make sure that we get things down to a level where this is manageable. So those 2 things are not in conflict at the moment, but yes, we do absolutely look at those long-term consequences and modelling that and thinking about what the implications of that is.
Ben, would you like to come back on any of that?
Yes, if I may, just on the care home point, First Secretary, it would seem the new measures that were introduced this week were a recognition that there wasn't enough in place to protect people in care homes and hospitals. Are you confident there now is, and that those measures will be enough to protect people in those settings?
Well, I noted that Care England, which represents the independent providers in the care sector, said it was heartening to know the government is listening, and it's really important, and we are continuing to listen. And as I said, this virus, the way it has spread has not been uniform or predictable, and we want to make sure that wherever it spreads, as we try and get it down overall, that we're there to make sure we've got the measures in place, the testing in place, the equipment in place to deal with it as soon as and as rapidly as possible. Thanks, Ben. Dominic Yateman from Metro.
Hello, First Secretary. Professor Ferguson said this morning that we will need to keep a significant level of social distancing until we have a vaccine, which we understand may take 18 months. Are you scared about discussing an exit strategy because there will be no real exit? And secondly, can I ask you, do you agree with the World Health Organization's assessment this morning, which put us in the same camp as Russia and Belarus with regard to our success in controlling the outbreak?
Well, I don't think the data internationally, and Patrick talked through some of it, which shows the international comparisons would bear that out. But I haven't heard and seen the direct comments, so I'll pass judgment for the moment on that. And in relation to your question about Neil, I mean, I'll ask Patrick to comment on it, but we've been very clear that we'll take the right decisions at the right moments based on the evidence, and they may well involve a transition out of the current measures, and of course they could be calibrated in different ways. And the reason that we need to do that is based on the 5 principles that I set out. How do we do this in a reliable way which protects the NHS at the same time as allowing us to ease up on the economy and engage more in the kind of social activities that people want to?
So I completely agree that the way out of this is vaccines and therapeutics. Those are going to be critically important. There are vaccine programs across the world, over 80 around the world. Probably 4 of those are in the clinic now. There are also therapeutic programs, both old drugs and people making new drugs. And those are going to be critically important in terms of reducing the effects of this disease and potentially reducing transmission. So vaccines and therapeutics, critically important, no question about it. And the UK, of course, is somewhere where a lot of that work is going on. Now, where we are now, as I've said, is that the social distancing measures are needed to reduce the levels right down to a low level. At that point, there may be decisions about which ones to relax and which ones not to relax. It's important to keep the R below 1. And this is all about trying to reduce contacts, particularly between households, reduce transmission, and keep the levels low across the community. So there may be a number of measures that need to continue in order to allow that to be suppressed and controlled whilst vaccines and therapeutics come along. But that's very different from saying that the measures that are in place now are the ones that need to be in place long term. So yes, there will be some changes, I think, that need to take place, that have already taken place around things like home working, that are going to be important to maintain that ability to break transmission. But vaccines and therapeutics are now being very actively looked at right the way across the world, including in the UK.
Dominic, would you like to follow up on that?
Thank you. And just in terms of lifting the lockdown, can you give us some idea of how many daily tests